wrist mechanical pain is very unique, different than wrist inflammatory pain, different than wrist nerve pain in the sense that I have pain some of the time when I do blah. For example, I had a patient the other day, it's like, I hurt when I'm doing downward dog and when I open the doorknob. Very specific. Another patient's like, I hurt in the morning, only, nothing else. The main thing here you have to remember is if you do not have nerve symptoms, so you have no zinging, you have no tingling, you have no numbness, because if those are present, even though you have pain in 2 movements, you have to go back and look at the video of the nerve. But if you have no zinging, no tingling, no numbness, no electrical feelings, only specific pain in the wrist, carpal tunnel area or not, when you do certain activities, 1 or 2 max, or certain times of day, and it hurts in one range of motion, only when I do this, doesn't hurt here, doesn't hurt here, doesn't hurt here, then you are in what I call the mechanical category of pain. Now, if you've watched the other videos, I start with the do not stretch. Now, in this one, it's not, you can stretch or not, irrelevant, like totally up to you. There are more, we could teach you more complex ways of dealing with it, but the stretching here, I'm not super against. Like, if it gives you some relief, go for it. But most of the time, I find it to be on the long term irrelevant. What's relevant is that you need to change your habits, because that's what caused it in the first place. So if you sleep like this, I don't care what you're doing, you got to stop sleeping like this. So if you are on your phone a lot and you're grabbing the phone like you're fighting with it, then we got to change it. We got to maybe put a pop socket in the back or put a ring where you're holding it like a book straight up here instead of like, it's this position that ends up hurting you. So why? What happens in this position? You end up having the claw. All of the muscles of the forearm here in the front get mega tight, and the muscles here in the back of the forearm get mega weak. So you're literally walking around like with your wrist like this. And that's where you'll be. And you're gonna hurt yourself. So the key with mechanical wrist pain relief is to change the habits that cause it, but also do the proper micro breaks, because we all work on our phones and we all work on a computer and it is what it is, c'est la vie, right? So what do? I'm gonna teach you this one thing called a micro break, and it's really to kind of start to help to restore the balance between these muscles and these muscles, okay? It took a Swiss neurologist to come up with it. So it's called the Brugger relief position. You open the fingers wide like that, and then you turn them out as far as you can. Chin in, take a full breath in, and breathe out slowly like that. Now, notice this. I'm not doing this. I'm not shrugging. I'm not pulling them back. It's very simple. Hands on the side. Open the fingers wide until they blanch. Turn them out. Chin in. Breathe. And what does it do? It turns on all the muscles in the back chain, and it turns off in your brain all the muscles in the front part of the chain. So that is how we're going to slowly start restoring balance. You do this 30 seconds every 45 minutes if you're sitting or standing. It's really not a lot. I mean, it sounds daunting, but you got to do it. If you do it every hour, I'm happy. And that slowly, 30 seconds every 30 minutes. That's kind of a quick one, like all you have to do. And notice that if over the next 3, 4, 5 days, it's not going to take that long, your wrist pain starts to improve, good. Just keep at it. If you're like, I'm definitely improving, but I hit a plateau, it's not going further than this, I need somebody to hold my hand, take me through a proper program of, okay, what do I release? What tool do I use? Do I take magnesium? What kind of supplements? Because all of these things we figured out for you. I mean, we've been doing this for more than 15 years. I've tested all of these things here at the clinic in Beverly Hills. There's clinical research on this. So if you go to mykinetics365.com, you'll find the treatment, the mechanical wrist treatment, to be that exactly. It'd be us holding your hand throughout, increasing, progressing slowly. You start with this, end with that. All of this in less than 15 minutes, okay? It's not gonna take that long. And most of our patients will improve tremendously in just as little as 2 weeks. So give it a try.